When I think about integrated care, I think about mind and body. So when we think of a person holistically, it's not just their physical health or their mental well-being, it's how all of those things play together.
Hello, everybody, and welcome to Talking Health with Health Solutions, a new podcast where we talk about behavioral and physical health. This podcast is being brought to you by Health Solutions, a nonprofit community provider that has been serving the Pueblo and surrounding areas for more than 60 years. On this episode, we have Andrea Alvarez, who is our Vice President of Medical Services. Thank you so much, Andrea, for being here with us today.
Thank you so much for having me.
This is Talking Health with Health Solutions. We're your hosts, Melissa Ayala and Nancy Gonzalez. And Andrea, we talked in our initial episodes just a little bit about our background. So as you know, I'm the director of the acute treatment unit and then oversee our recovery solutions and been with Health Solutions for approximately 10 years. And just have really evolved in my role and have learned so much about just community mental health and the growth that we've had over the past 10 years. And I think, Nancy, you've had some of the same trajectory within Health Solutions.
Yeah. So I've been here for 10 years, and I started off at Crisis and then got my undergrad and transitioned into my current role as a coordinator. And I've been there as the suicide prevention coordinator now for 4 years, which does not seem like it's been 4 years. I feel like time goes by so quick. I was so eager to grow up. And then now that you grow up, you're just like, wait, give me a minute. A little bit that we talk about ourselves, Sandra, but, who are you? To our listeners that maybe don't know a lot about you, where do you come from? How did this all come about?
Sure. So I'm part of the 10-year club also. I've been with Health Solutions for about 10 years.
It's when they got all the good people.
I feel like that's when they hit their stride.
Yeah.
So for 10 years, I actually started in our integrated primary care clinic, and it was a brand new thing. I'm a registered nurse by training, and I came from an oncology department. And life circumstances, it just worked out to where job in primary care would be an ideal fit for me at the time. Mm-hmm. So I started as a registered nurse and care coordinator and was part of our integrated pod. So
wow.
Yeah.
Wow.
You
really cool.
say an interesting word, integrated, and that is something that we've really established here at Health Solutions. So what is integrated care for those that aren't quite sure what that means?
When I think about integrated care, I think about mind and body. So when we think of a person holistically, it's not just their physical health or their mental well-being, it's how all of those things play together. So when we started Health Solutions Family Medicine over 10 years ago, we were looking at how can we integrate those services together. So how can you get primary care in one place as well as your behavioral health concerns addressed. So
and it's very
for
important.
me, integrated care, team approach, and things may be episodic or they may be ongoing. We may be treating, someone who is dealing with grief for a short period of time, or we may have someone who has, recurrent long depression, bipolar, those types of things, and making sure that both their primary care well-being and their mental health is addressed.
Yeah. I think that has, in our first episode, we had our CEO, Jason, and he talked a lot about like the origins of Health Solutions and just how we've evolved. And I think that this speaks to the volume of that as well, too, that, this integrated health had started off 10 years ago, but just to see the difference of what it is now compared to what it was back then, I'm sure that you've seen such a big leap and have seen a lot of more things come forward with that. Back then, when I first started, I don't necessarily think that integrated health was a term that was kind of used a lot. Would you agree, or how do you feel like that shift has been?
I do think that, and I think it's still catching on. I think because it is such, sometimes I think an underutilized practice, marrying the two together. Health Solutions has set up just the perfect environment for that. And, you'll have industry-wide, there's a lot of places that start with primary care and then integrate in some behavioral health. Health Solutions did it a little bit different. We had behavioral health pretty much established and then added in primary care. So it's been really neat to see how it's evolved, and two, how we're always fine-tuning and looking at things in a different way. When we started, we had, a behavioral health clinician. We didn't have a psychiatric mental health prescriber. We now have that as well.
Nice.
And when we started, we didn't do any kind of medication-assisted treatment. We added that element in. So it's just kind of, looking at the population that we serve and what the needs are within that population. So, and I don't think we're done growing and evolving. So, times change, things change, and really trying to adapt and innovate.
Absolutely.
Andrea, you mentioned medication-assisted treatments. Can you tell us what that is? Because I'm sure a lot of our listeners are like, what does that mean? Or how does a client qualify or have the need for that type of service?
So at Health Solutions, we have 2 medication-assisted treatment facilities. We have, and we call them the MARC, the Medication Assisted Recovery Center. We have one in Pueblo, and we also have one in Trinidad. And we are able to treat both opioid use disorder and alcohol use disorder. And the treatment can vary from different types of medication. We do like to advocate for the therapy, behavioral health groups, those types of things as well. But if they are just needing that medication for stabilization, we're able to provide that.
Wonderful. And how important is that in a community like Pueblo?
Oh, so vital, so vital. And, you really are able to see lives change.
Yeah. Yeah. Well, I think that it goes back to like when you said, Andrea, earlier, like, nobody thinks about the concept about those two being married together, and they very much go hand in hand, that physical side of health and then the behavioral side of health, they truly go together. So to see that being now part of Health Solutions, and like you said, we're evolving every day, and the growth that we still have to do is really nice to see. And I think to play on that as well too, like Melissa said, is there any stories that you can share with us where you feel like integrated health has really made an impact, or maybe impacts that you're seeing?
Definitely. I think one of the main things is majority of individuals will have a primary care provider. The majority of people I know don't necessarily always have a behavioral health provider.
Yeah.
Most people have been seeing their primary care provider for years, if not decades. Right. And so you have that relationship that already exists. Mm-hmm. And for some people, it can be very scary and very intimidating to take that step and reach out for help to support their mental health and their behavioral health needs. Right. One of the things that I think is very important is we do a depression screening on all of our patients. It's called the PHQ-9. And statistically, from the National Institute on Mental Health, they had information that when someone has completed suicide, that they have typically had a primary care visit within the last 30 days. And that's in 40%.
Wow.
Now, because we do that PHQ-9 screening with all of our clients, they say that can reduce that 40% by 25%. Yeah. So I think that's huge. Absolutely. And there's some things that you just can't quantify, but knowing that we're doing that screening. And of those screenings that we provide, anyone who would screen as positive, so meaning that they did have higher depression, mm-hmm. they would get followed up within 30 days. And out of that, we followed up on over 98% of positives within 30 days. So I think that is really powerful. And I think, too, it just opens up that conversation.
Right.
That, we're not just thinking about, if you have diabetes or hypertension or, any of the other things, that we're looking at everything together.
Yeah.
And what makes that really unique is then we have a direct pipeline to get them connected to services because of that integrated healthcare approach. And so when they are struggling and coming in with just to see a primary care doctor, but they do screen positive on a PHQ-9, we're saying, here's a person that you can talk to immediately, and we're connecting them to services within the same organization.
Warm handoff.
Warm handoff.
100%. It makes it so it's less scary. It doesn't seem like it's a big thing, that, this is just part of our normal process.
Yeah. And Melissa and I do a lot of suicide prevention trainings. And I think that's one thing that we hit on as well, too, is that, the majority of sometimes people who actually complete suicide do have a primary care physician. And, normalizing asking that question. A lot of the times we get afraid to ask that question, are you suicidal? And we talk about the importance of how to ask that question as well, too, because there's a big difference between, that person that you trust telling you, like, are you suicidal? You wouldn't do that, opposed to being like, hey, like, when things happen, things get rough. Like, I get it. If you are thinking this way, let me help you. Mm-hmm. So there is a big difference between how you ask it and not being afraid to ask that question.
100%.
So within the community of Pueblo, what are some of the things that you really want our listeners to know, not only about integrated care, but just health solutions as a whole?
For me, with health solutions, this is especially our primary care and our behavioral health services. It's a mission, and we have such wonderful, well-trained, caring providers who can help develop that partnership. And I think healthcare is all about partnership. Sometimes it can feel a little transactional, and really, when you look at the whole person, mind, body, and soul, that really changes things for some individuals. And we really work hard to make that happen. In Pueblo, I think, having people who are culturally aligned, who have an understanding of the community and, some of the stressors, and, can identify trends and, recognize those things and provide some level of coaching along with that healthcare. I think that's really important. So if someone is looking for an integrated approach with highly trained professional staff, Health Solutions Family Medicine and our new location, Perry Hall, are going to be excellent places for them to get the care that they need and want.
Yeah. You mentioned about culture and just how important that is for people to feel heard and people to feel valued and their mind and body integrated into providing care that touches all of the person. And so one of the things that we've really adopted here at Health Solutions is the culture of echelon front. Yes. And that has become a wide range of what that looks like within a community mental health organization. So can you talk a little bit about what Echelon Front has meant to you and how you've adapted some of those extreme ownership principles within your work and within your life?
Definitely. Actually, I just got back from a conference. It was a women's leadership conference that was led by Echelon Front team. And for me, I think, the ownership piece. I think we can tend to just, in our daily lives, get into a place where it's easier to blame someone. Like, I wasn't able to do that because someone didn't do this. Mm-hmm. And for me, Echelon Front has really changed that to, did I do everything possible to make it happen? Mm-hmm. And that's kind of one of the questions that I ask. So when I find myself like, well, hold on, that didn't go as I planned, what part did I have in that? Another thing that's really exciting to me about the Echelon Front leadership format that we use, or framework, is the innovate and adapt. And I think that is so powerful in healthcare. There are certain things that, and you guys know from a clinical standpoint and regulation standpoint, there are certain things that have to happen, but there are certain things where we're able to look at a process and say, how can I make that go better? How can I support someone better? How can I make it easier? What can I do to refine? And that really highlights that, you can innovate, you can adapt, we can figure things out because the landscape of healthcare is ever changing. And, I think we've probably all seen that play out in just our roles here at Health Solutions. I started out as a care coordinator, registered nurse. I moved up to a director position. I opened up a new program, and then I moved into a vice president position. And one thing that I think is important is that everyone leads. And so you take those opportunities, you see where you can make changes. And I think when you have our patients and our clients, their overall health and well-being at the forefront of your mind, this organization has been wonderfully supportive in driving initiatives forward.
Absolutely.
Yeah, absolutely. Thank you. Thank you for that, Andrea. I think that it's very nice to hear from you, and, the integrated health part of it as well, too, because those are sometimes terms that you're just like, wait, what does that really mean? So you've put it into perspective very nicely. So appreciate you. And, we want to thank you for being on the episode today. It's been a pleasure talking to you. And, we like to do like this rapid fire questions. So we're going to give you a couple questions. And I always like to tell our guests that these are questions that are going to either make or break you. Either Steph is going to be like, yes, I'm with Andrea. I knew I liked her from the beginning. Or they're going to be like, I don't know about her taste in some things. Okay.
Excellent.
So don't think about it too much. Just
Okay.
first things that comes to mind. Ready?
Yes.
Does pineapple belong on pizza?
Yes.
What the heck?
Three people.
3 for 3, and I'm side-eyeing you.
Okay.
Is hot dog a sandwich?
No.
Okay.
Everybody's on board with that. Like,
Yeah.
I
Yeah.
haven't heard somebody say that hot dog is a sandwich quite
Right.
yet.
Yeah. So then what would you classify a hot dog then?
Ooh, like a meat substance, kind of like, I don't know that you would like thinly slice hot dog to put it on some white bread.
Yeah.
So
Yeah, you're right. I think that everybody kind of has said the same thing. Like, it's just mystery meat. Like, it just kind of
it's a little bit of everything.
yeah, exactly.
So
Integrated meat product.
There you go. That flows with integrated
That was
healthcare.
great.
That was
great.
good.
Yeah.
So, Andrew, before we let you go, thank you very much for being here. We appreciate you. What is the one mental health tip that you live by within your daily life?
I think being mindful, like being conscious of where you are, the space you're in, and really trying to make the best decisions possible. There was a fact that was brought forth, and it said that on average we make 35,000 decisions a day.
Wow.
That is huge, and that can be very stressful. So I think taking the time just to take a deep breath in, focus, what's the goal, and try and make those best decisions out of the 35,000 that you have to make. So
A lot.
Absolutely.
that's a
Yes,
lot.
that's a lot of decisions. Well, thank you for deciding to be with us today. We appreciate that. And until next time, Talking Health with Health Solutions, have a great day.
Bye.